So one, how do we know that the eggs are okay? For the woman, to know that for us to know that the woman's eggs are okay, one, you look at her age, because this is one of the commonest factors. If you see the woman is within the productive age, that's a tick. But then you look at...
The productive age is 18 to...
Oh yes, that's good. Within the age of 18, actually from as low as 15, but between 18, between 18 to 35, that will still be considered a good age.
Okay.
Yes, but then also her periods, you have to see if the periods are coming regularly and she's not missing her period, that's a good thing. But you must confirm the situation of the egg with the hormones.
Okay.
There are specific hormones which tell you that yes, the eggs are enough and they are of good quality.
Okay.
Yes, we do those hormone tests. So that is for the egg. Then for the tube, the most used test is what we call the HSG. It is the X-ray test for the tube. That X-ray test for the tube, which we saw on the images, it will show you what the normal tube is like. It will show you what the abnormal tube is like.
Okay.
Now, for the womb, the examination of the womb needs a scan, an ultrasound scan. There are different problems of the womb which may show up, and so it will be seen on the scan. Okay, the ultrasound scan, we can see a normal ultrasound scan image. Let's have a look at it. So when we do the scan, this is how a normal womb will look like.
Okay.
Nice. This is the muscle, and this is the lining inside. So this is how it will look like. Very simple to see. Even the doctor can show you when they are doing the scan. Yes. For example, some abnormalities can be like the fibroids. Maybe we can have a picture of the fibroids. So if you see the difference, the previous one was nice.
So
it was
clear.
all looking like that.
Yes.
But now we have a ball here. This is a ball.
That is a cyst. Is it a cyst?
No, this is a fibroid.
A fibroid
Yes,
that has developed in the womb.
Yes. So such may be
Okay.
one of the problems with the womb. Yes. So this is what the scan shows you. And by just this simple test, which is available almost everywhere, you're able to tell that the womb has a problem or it has no problems. And in some centers like ours, we're able to evaluate this further and see the relationship between this fibroid and the cavity of the inside. So we have some additional modification of this test. What we call the sonohysterogram, where we put in some fluid and you're able to see the ages very well, and you know, oh yeah, this is the, and even it's not magic, the patient can see it for themselves. So this is how you assess the womb.
Okay.
Yes.
Okay.
Yeah, and then for the tube, we can have a review of the image for the tube. So this is the X-ray test for the tube. They appeared here, the tubes, the normal tubes, and spill out like how I said before, and the womb cavity also is seen here. We can have a look at the blocked tube. Yes, so again for the blocked tube, you will see the cavity of the womb is seen. The tube appears but stops somewhere here and stops somewhere here. That indicates the blockages.
Okay.
Yes, so this is how it is done. These are simple tests and they're not very expensive.
Okay.
Yep.
Thank you.
Yep.
Thanks so much, Doctor. Please have a seat. Doctor, we have gone through all the illustrations. Now we want to look at the treatment. Are there possible treatments of especially one blocked tube? Let's start from there.
Yes, there are treatments. There are treatments for most of these causes of infertility.
Okay.
For the blocked tubes, it depends on the extent of the blockage.
Okay.
Some of the blockages are mild and minor. You don't have to do anything about the tube. Sometimes you advise the people to either time, or you give them some medication to increase the number of eggs to overcome the scarcity of the inability of the tube to move the eggs. So if you provide for it more eggs by stimulation, you'll be able to overcome.
Okay.
Now, in some of the cases, you have to correct the tube. You have to work on it to make it go back to the normal functioning state.
How do you do that? Through surgery?
Yeah, most times it would require some surgical intervention. Some of it may be minor, some of it may be major, depending on the problem. Currently, the recommended approach is, depending on where the blockage is, the recommended approach is to use hysteroscopy Well, this is a procedure which is done. Some camera and the gadget is put through the cervix, and you go into the womb.
Or you're able to see whatever that is
yes,
inside.
So so for the blockages which are right inside the womb, you are able to unblock from inside.
Okay.
And also you could use laparoscopy, which in this case approaches through the abdomen inside. So those are procedures which are done in the theater.
Okay.
They are invasive, but not as invasive as the usual opening technique. Yeah, okay. So you do that. At some stage earlier on, before these laparoscopies and hysteroscopies became available,
okay.
we used to flash. They will do flashing of the tube.
Okay.
So the doctor would use some medication mixed with some fluid and push inside,
okay.
and then with the hope of unblocking the tubes.
Okay.
Yeah, that's what we used to do. But now we don't do that much.
Okay.
So we now go for either hysteroscopy or laparoscopy. Yeah, if it is a blockage of tube and you want to unblock.
Okay.
But some cases are so severe that you don't need to unblock them. You have to go on and do IVF. Which means instead of the sperm and the egg meeting inside the tube in the woman's body, you get them out. You get the egg out and you get the sperm out, and you make them to meet in the lab, in the specialized lab of the IVF.
Okay.